welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Aaron Fine for MS Focus, and I'm joined by Christine Hampton, occupational therapist at the Ulysses and Andrew C. Carlos Multiple Sclerosis Rehabilitation and Wellness Program at the Shepherd Center, who will be talking to us today about the secret symptoms, bladder and bowel dysfunction in MS. After a presentation from Christine, we'll open up to your questions and comments. Now, I'm delighted to introduce our speaker. Christine Hampton has been with the Shepherd Center for over 6 years and has worked with patients with spinal cord injuries and multiple sclerosis. She received her Master's of Science in Occupational Therapy from the Medical University of South Carolina and currently enjoys working with individuals with multiple sclerosis as an occupational therapist. She lives in Athens, Georgia with her husband and facility dog, Errol. And fun fact, Errol enjoys joining Christine in her therapy sessions to work with her patients. We are so pleased to have her join us to present this important topic. Christine, thank you for being with us, and I'll turn it over to you now.
All right, thanks for having me, guys. I will admit that Errol is here next to me, my facility dog, so he's usually really good, but if you hear any snoring, I promise it's not me. It is Errol, but he is a snorer when he's sleeping, so just a heads up that you might hear that. So I'm Christine. I'm here to talk to you about bowel and bladder symptoms in MS and just some strategies to help with that. I will say I love talking about this because I find it's a topic that isn't often talked about a lot, but it's so important and it impacts so many people. So I'm excited to jump in. We'll go over some information and we'll do some questions at the end. So feel free to ask away. All righty. So kind of the objectives of today are to see how or talk about how the gastrointestinal system and the urinary system work, factors that impact bowel and bladder function in MS and just in general, and then also lifestyle modifications and strategies to assist with bowel and bladder function. So kind of that will be our journey today. All righty, so let's start with bowels. So bowels actually can affect more than 50% of people with MS. So it can be quite important topic to talk about. I find that it often stops people from going out and about. So I just love getting a chance to chat about since it is so important. Okay, so first we're going to look at how the GI system works and kind of what is happening when you eat to the point that you have a bowel movement. All right, so you'll see a picture up on the screen that we'll kind of walk through as we talk through the process. So first, you're eating that yummy meal, that delicious food. It's going through the mouth. Then it's going to move down through your esophagus. It'll then move to the stomach, and in the stomach, that is where the food is broken down and nutrients are absorbed at that time. It'll then continue to move into the small intestine, where it is broken down some more nutrients are absorbed there. Then it'll move, as you can see on the screen, down to the large intestine or the colon. Now in that area is an important step happens where water is actually kind of removed from it to help form the stool and to kind of make it a little bit more of a solid structure of mass, we could say. So after that happens in the colon, it's going to move to the rectum. In the rectum, signals are actually sent to the brain, and it says, hey, the rectum's full, and it is either stool or it's gas, and then that lets the brain know, okay, this is a good time to go, or nope, it is not time to go. You don't want to pass gas in the middle of this meeting. So that kind of is what happens in the rectum. So important signals are sent there, and then let's say that signal's sent and it's a good time to go. Then that stool will move through the anus, where your sphincters will relax, and the pelvic floor will also help with getting that stool out. So there's a lot that happens when we take a bite of that sandwich and to the point that it exits our body. So kind of what we'll do next, we'll kind of jump in to kind of what are some of the things that we should expect with our bowels, and what are some of the things that can go wrong, and then what can we do to help with it? Alrighty. Okay, so what to expect with your bowels. So a lot of people, when they come and talk to me, they think, okay, I should be having a bowel movement every single day, and that's not happening. But technically, a normal bowel function is 3 or more bowel movements per week. So if you're having less than 3 bowel movements per week, then we get a little concerned, and we want We want that number. Also, you want your stool to be nice and well formed so that it's easy to pass. We don't want it to be too hard where you're having to strain to get it out. We don't want that liquidy diarrhea, because then that can be tough to hold it in, and sometimes that can lead to more incontinence. So we really want enough bowel movements during the week, and then also we want some good stool too. Alrighty, so what would be abnormal bowel function? Well, needing to strain to pass the stool. So if you're having to really strain to get it out, we don't want that. That can lead to hemorrhoids and different problems. So we definitely want to avoid the straining. Feeling unable to empty your bowels, that can definitely be something we don't want. So we want to feel like you can empty those bowels. Also, if you're feeling any like a hard abdomen or discomfort or a full sensation, that would not quite be normal. Discomfort with sitting or pressure in the rectum area. And then lastly, blood in your stools. And we will talk later on a couple slides about what are some of those red flags that it's time to call a doctor and that we're concerned. But I would encourage you that if you're experiencing any of these abnormal bowel function symptoms that we talked about, that you do talk to your doctor about it. All right. Okay, so we kind of talked about what can be normal with bowels and what can be abnormal with bowels, but what is causing this abnormal function that we talked about? Well, with MS, with the lesions that can occur in the brain and the spinal cord, that can actually mess up the communication that's occurring. And your brain, your spinal cord, and your intestines all need to communicate to help those bowels kind of from the point that you eat it till it moves out. So that communication can get a little wonky with the lesions, which can impact your bowel function. Similar to how with MS you can have difficulty with your hands or your legs, whether it's coordination or strength or even tone, you have pelvic floor muscles that help control your bowel and bladder function. And so MS and the lesions can impact those pelvic floor muscles, causing weakness. It can be overactive, trouble with coordination. And so when that is impacted, that can also have a negative impact on your bowels. All right. In addition to that, decreased mobility. So often I found with a lot of the individuals I work with the MS, mobility can be challenging, whether it's fatigue or weakness or just it's hot and that leads to fatigue or weakness. There can sometimes the movement can decrease because it's just hard to move. And movement is quite important with your bowel function. So I find that when there's decreased mobility, that can negatively impact your bowels. All right, and then decrease fluid and fiber intake. So fluid is super important with your bowels. We'll get way more into this in the next couple slides, but it really helps with constipation and keeping it moving and such. And so when we decrease our fluids, especially if we're worried about having bladder accidents, then that can really impact bowels as well. So making sure we're getting enough water, and we will dive way more into that to see how much fluid you should be trying to get. Fiber is important as well. So just briefly, fiber helps kind of bulk the stool and move the stool and form the stool. And so if we're not getting enough fiber, that can also impact our bowel function, especially with the consistency of the stool. So how hard or soft your bowels are. And then medications. So medications can cause constipation or diarrhea. And so it's tricky though. You want to kind of weigh the pros and the cons because a lot of those medications are definitely necessary and needed. So just a conversation with your doctor if you are experiencing constipation about what medications you're on and if there's anything you can do with that. Okay, and we will talk more about these factors in the future slides as well. All right, so what can go wrong with bowels? Well, constipation is one that I hear quite frequently with the clients that I work with. So constipation is going to be fewer than 3 bowel movements per week, generally speaking, having hard stool, straining, feeling like you're unable to empty completely. And then also it can be having to manually remove the stool. So sometimes that's using a finger or to insert to remove the stool, so having to manually remove it. So those are kind of some kind of signs that we might be experiencing constipation. Now, constipation can be caused by not enough water, change in your diet, the activity that we spoke about earlier, ignoring bowel urges. So actually when you ignore a bowel urge because you don't, it's not the best time, or you just don't feel like going and dealing with the pants or anything, that can actually make your constipation worse. So that's a factor that can lead to more constipation. And also those lesions we talked about and just the impaired communication that's happening, that can be happening between the brain, the spinal cord, and the intestines. So that can all kind of lead to that, constipation. And as well as kind of the pelvic floor muscles and the abdominal muscles, if they are not contracting in the ways that they should and functioning how they should, that can also impact constipation. All right, so incontinence is another common one that I hear with people that I work with. So incontinence is an involuntary loss of stool or an unplanned bowel movement. So this means when you are just not expecting, you don't have control of it quite, and you're not expecting it, and it happens. That would be incontinence. So incontinence can come from medication. So there's certain medications that will cause diarrhea, which can make you more prone to incontinence. Also impaired rectal sensation, so not feeling that your rectum's full can also lead to incontinence. And then having dysfunction with the anal sphincter, which helps control or lets those bowels evacuate, or dysfunction with those pelvic floor muscles that also help to control the bowels. So those are kind of three of the main things that can lead to incontinence. So some people are quite surprised about this, but you can have constipation and incontinence. So you can be backed up and then you can have that diarrhea as well. And this is coming from your rectum being overloaded or overflowing, and then also having that impaired rectal sensation. So it's getting overloaded, and at the same time, you're not realizing that that's happening, which can lead to that incontinence. So, and then the last one we'll talk about for potential problems today is fecal impaction. So this one's quite important because if you are experiencing this, you do want to go to the doctor. So this is when you're unable to have a bowel movement. A large mass of stool has formed and kind of is in your rectum or your colon area, and you're unable to pass it. And at that point, you would want to let a doctor know so they can help you out with that. Okay, so we have been talking a lot about hard stool, soft stool, kind of how that impacts, water impacts it, but let's take a deeper dive into what we want our stool to look like. What's kind of the goal? Now, I will say it's can be different for different people depending on the bowel program you're on. But if you are kind of having a self bowel movement, or you're going without equipment, I'd say we're looking towards the middle of the chart. If you see that on the screen, the type 4. So type 1 is going to be more of those hard lumps, or those like nuts basically, and they're like little rocks coming out, pebbles, and that can be really tough to get out, and it tends to strain. We tend to strain more with that. The same as with type 2, that lumpy and sausage-like stool, that can also be really tough to evacuate or get out. Type 3, we're definitely getting better. That is sausage with cracks. So that one we're doing okay with that. Type 4 is nice. That is a smooth, soft sausage or snake. And then type 5 are soft blobs with clear-cut edges. And type 6, the mushy consistency with ragged edges. And then type 7, you are getting to that liquid consistency with no solid pieces. So when we are getting type 6 and 7, we're definitely in the danger zone of diarrhea. We're wanting to stick more to that 3 through 5, but that middle kind of the 4 is ideal. I will say this is my favorite chart, I think, in the world. love to share. I think everyone should hang it in their bathroom so they can see how they're doing. But it is a great chart because it can let you know kind of where you're falling. So if you're heading more to the type 2, it might let you know, oh, I need to make some changes before I get to that type 1. It's even harder to pass the stool. Okay, so we'll refer back to this chart. We'll be speaking about these different numbers in the coming slides. All right, so we have talked about problems, things that can cause the problems, what should we expect, what should we not expect. So now we'll kind of jump into the fun part that I find, and what can you do about this? So what can you do if you are experiencing that constipation or that incontinence? How can we change it? How can we help? So we'll be focusing on the next bit on those lifestyle modifications and strategies. All right, so the ones we'll be talking about today are positioning, bowel routine, breathing, diet, water, and exercise or activity. Okay, so the first one is positioning. So if you see on the slide, the guy on the right with the check mark is kind of what we're looking for. So when you have your feet elevated just a little bit, this can be like on a footstool, or they make specific stools for this as well, but really just having those feet elevated, it puts your body in a better position for bowel movements. So we're looking at kind of about a 35-degree angle, what we're looking for this, but when it elevates a little bit, it helps the pelvic floor muscles relax, and it can reduce strain for a bowel movement. So I find it's worth a shot for people to see if it'll work for you, because it can often be a simpler thing to do, to grab a stool and see if it works for you to reduce strain. And all these things, I don't know specifically what you guys are going through, but they're things that might be helpful. All right, so that's positioning. So we're looking for those feet elevated. Okay. The next one is bowel routine. So our bodies love a routine when it comes to our bowels. Often people tend to go around the same time each day. It's always in the morning, it's always in the evening. And then sometimes with MS, it gets a little wonky and people are like, I am no longer on my schedule. But our bowels actually like routine. And this can be good if you're having constipation or incontinence, is trying to get those bowels back on a routine. It can also help with kind of if you're doing it in that position with the stool up, avoiding straining too. So that can be part of your routine. So the goal with this routine would be picking around the same time each day that you want to try to go and sticking with that. So let's say 10 a.m. in the morning is when your body tends to like to go, then it would say, okay, at 10 o'clock each day, I'm going to set aside some time to sit on the toilet and see if I can have a bowel movement. Now, when you're sitting on the toilet, you can sit sit on the toilet up to around 20 minutes, but you should not be straining. So you can give yourself some time to see if you can have a bowel movement, but there should be no straining during that time. Once again, that can lead to other problems like hemorrhoids and such. So no straining. But you can sit up on the toilet around 20 minutes or so. You can also, part of your routine is about 20 to 30 minutes before sitting to have a bowel movement, you can try to drink something warm or eat something, and that can often get the bowels going and kind of trigger them to move. So I often tell people, okay, let's pick a time that you want to go. Let's say it's 10 a.m. Then maybe 9:30 you're drinking something warm or eating something. 10 o'clock you're sitting on the toilet with your feet elevated for around 20 minutes or so, and then seeing if that produces a result. So that can be kind of a nice little routine to try out and see if it works for you. So timed voiding. So this timed voiding, or kind of setting this routine for yourself, can also help. It can help with constipation, but then also incontinence as well. So especially if you're not feeling a bowel urge and then all of a sudden you're having an accident, trying to get your body on that schedule to kind of catch it before you have that accident. So yeah, it can kind of work for both constipation and incontinence. All right. Okay, the next lifestyle modification we're going to talk about, or a strategy, is breathing. So breathing can be really helpful with activating the parasympathetic system, which helps with having a bowel movement, and then also relaxing the pelvic floor muscles too, to help with having a bowel movement. So when you're breathing, it should come from the belly area or the abdomen. So less of the chest breathing, but as you can see in this picture, it's more of that belly area. So what you should be doing, or what I kind of coach people through, is when you're breathing in through your nose, kind of put your hands on, I don't know if you can see me, but put your hands on your belly area like in the picture. And then when you breathe in, you should feel your stomach or your abdomen area expand. And then when you breathe out, you should feel it actually coming back in. So breathing in, it's going out, and breathing out, it's coming back in. So that can help with bowels. And the question is, when do you do this? Well, during the bowel routine. So if you are sitting on the toilet and you're having trouble going, or you're just kind of giving yourself some time to go, that is when you want to start that breathing to see if you can help the process along. So when you're on the toilet, you can add the breathing in with the positioning and the routine and all of it. Okay. Let's see. All right, diet. Such a fun one to talk about. So we've talked about positioning, we've talked about routine and breathing, how all those things can help, but something that's also super important is diet. So fiber can help with constipation and diarrhea, so just in general, it's good to be on the lookout for. Fiber helps by bulking up your stool to help with the transit, but then also can help with forming the stool too. So it just plays a big role in bowel function. And there's two types of fiber. There's insoluble and soluble fiber. They both help with your bowels. It's good to get them both in. Some examples: whole grains for insoluble fiber would be whole grains, nuts, beans, vegetables. Soluble fiber can be grains, legumes, fruits, vegetables. So those are just some examples, but trying to get kind of both those fibers in can be helpful. Now, as you're doing this and trying to get in them, it's often helpful to start slowly and make sure you're drinking fluids as you're doing this. If you increase your fiber too quickly, that can cause some upset. So just making sure that you're increasing it slowly and you're drinking water as you're doing this too. So we've learned fiber is good for constipation and diarrhea. You want to increase it slowly and you want to drink fluids with it, and then getting a nice variety in of those insoluble and soluble fibers is helpful. All right. On the other hand, there are some trigger foods that can cause more problems. So those are ones that we want to avoid, or just know, hey, okay, if I'm going to eat this, there's a chance that I might have some constipation, or if I might have some diarrhea. So when we're looking at trigger foods for bowel accidents, that's going to be more, and it's not the same for everyone. A lot of these things we're talking about are general. It's not specific per person, but some of the common ones for bowel accidents are going to be your spicy foods, your raw fruits and vegetables, alcohol, hot or cold foods, caffeine or tea, carbonation, sugary drinks, and medications. So those can be, medications not a food, but those can be triggers. You know, a lot of things on that list are the yummy ones, but they can trigger it. So I often tell people, not saying you can never have those things, but just knowing that if you find that one of those is a trigger for you, then knowing that if you're going to go out and about, it might not be the time to have it. So constipation, there's also triggers for that. Dairy, meat, fatty foods, fried foods, and medication. So once again, the foods on the list often are the yummy ones, but those can sometimes trigger constipation. And like you said, it's different for everyone. I often have people kind of create a bowel log, and they can track what they're eating, what they're drinking, when they're having a bowel movement, the consistency of their stool, if they had to strain, activity for the day, just to kind of see the trends that are going on, to see if there's anything that caused a problem. Okay, So it can often be really tough to get that fiber in, especially if you're having difficulties with cooking because of fatigue or weakness, or the heat in the kitchen that can lead to fatigue and weakness. It can be tough to fit in those different foods that can sometimes take more time to prepare, depending. But I find that making a meal plan can be quite helpful with meeting these fiber goals. And so with the meal plan, what I'll usually do with my clients is I'll have them make a list of breakfast, lunch, dinner, and snack foods that are easy to make, that are good for their bodies. So easy to make, good for their bodies, and that they like to eat. And so they'll make kind of a bank of those ideas under breakfast, lunch, dinner, snacks, and then they can use that bank of ideas to then fill out the meal plan, and then kind of plugging and chugging along for what they want for breakfast, lunch, dinner, and snacks. And I always encourage people, when you're filling out this meal plan, I should see a lot of repeating meals that are repeating. So you're trying not to cook every day just to conserve energy, but instead trying to, if you're okay with leftovers, trying to eat them again, just so you're not having to cook as much. But I often find that a meal plan really takes the idea of fiber and just makes it a lot easier to get it into your schedule and get it into your day-to-day. So I often tell people, start with making a bank of ideas for all these different meals and snacks, and then using that as your go-to to fill in the meal plan. I find that this can be really helpful for people with changing diet. And there's always dietitians out there as well that you could look to as well that can give you more specifics with your food. Okay, so we talked about when you're eating more fiber, it's important to get water in. So water works with the fiber to move the stool, so you really need both of them. It also helps with your stool consistency, so kind of helping it not to be as hard, which will be easier to pass, it's not as hard. So it really plays an important role. So how much do we drink? So the general rule of thumb is about half your body weight in ounces of water per day. But I will say it varies from person to person. It depends on how much activity you're doing, how much you sweat, a variety of factors. I tell people to take a look at your pee. Your pee can kind of give you a heads up if you're drinking enough water. You want your urine to look clear to pale yellow. And I do have a chart coming in the next couple minutes about, or you can take a peek at the colors of the urine and what you want yours to look like, but more that clear to pale yellow is going to let you know that you're on the right track. Now, just like food, it can be hard, and fiber, it can be hard to get the water into your daily schedule. So I do encourage people to pick a water bottle that they enjoy drinking out of, and then setting a goal with that water bottle. So this is mine for the week, but I will set a goal each day and figure out, okay, how many of these do I need a day to meet my daily goal? And then throughout the day, that gives me a visual reminder when I'm looking at my water bottle and saying, oh my goodness, it is lunchtime, I haven't even made it through one. So I find that having that consistent water bottle at least helps me, and it has helped the people I work with kind of stick with those goals. Okay, so we touched on this earlier, but exercise and activity is important. So it impacts the bowel function that helps with digestion, it helps with muscle contraction, and then also helps with the bowel transit time, or that the bowel's moving through, which is important to help us not have constipation if it's moving too slow, or diarrhea if it's moving too fast. So activity and exercise can help with all of that. It can look very different from person to person. So it can look like running a couple miles, or it can look like doing some stretches, or cleaning the house can be some exercise or activity, or doing a boxing class. So it can just look very different from person to person, and what you can do safely and not fatigue yourself too much. But just getting moving can help with that, with your bowel function. Alrighty, so some of the things we talked about today that might be able to help with some of the difficulties with the bowels are positioning, bowel routine, having that bowel routine, consistent bowel routine each day, and having the position while you're doing the bowel routine, breathing while you're trying to have that bowel move, and those deep that deep diaphragmatic breaths out of the belly area, not the chest. Looking at your diet to see, okay, am I getting enough fiber? Looking at how much water you're drinking to make sure you're getting enough water, because that helps. And then your exercise or activity. So we will not go into great detail in these today, but other options to look into that could be a discussion with your doctor or pelvic floor therapy. So there are specialists that people that specialize in the pelvic floor muscles. So what they do is they can help with retraining those pelvic floor muscles if they're weak, if they're having difficulty with coordination, if they're overactive. And so a lot of times those pelvic floor muscles play a huge role in our ability to have a bowel movement, but then also to hold it if it's not time to have the bowel movement. And so working with a pelvic floor therapist can often, if it's appropriate for you, can help with seeing if those muscles are functioning correctly, and then help you with getting them on the right track. So definitely a conversation you can have with your doctor if you think that would be helpful. See what they think. Medication as well can help, could be helpful. Other options are colostomy, pads, briefs, diapers, and sacral neuromodulation. So depending on the person, what you're comfortable with, what you want to do, and what your doctor thinks is appropriate, those are some other options. Okay, so we talked about a lot of things with bowels, but definitely if you are experiencing some of the red flags, I guess you could say, if you're experiencing blood in your stool or you are unable to pass stool or gas, I would go ahead and reach out to your doctor, because that could be just red flags that something's definitely not going right. And if you're experiencing any bowel dysfunction, you can definitely have a talk with them, and I'd encourage that. But these two are ones that are red flags that something else might be going on. Okay, on to bladder. So we learned that bowel dysfunction is quite prevalent in MS, but then also bladder dysfunction is as well. And it's been reported that up to 75% of people with MS can experience bowel dysfunction. So it can be quite common. So similar to bowels, we're going to talk first just about how the urinary system works. So what is going on? How do we get that urine out of us? So first, kind of what's going is your kidneys are filtering your blood throughout the day, and then drops of urine are then forming. That is being sent to the bladder for storage. And then when that bladder gets full, or in a fully functioning bladder, when it gets full, that bladder will spasm and it'll let the brain know, hey, it is time to go. The brain will be like, nope, you are in the middle of this meeting. It's not time to go. Or it'll say, yes, you are sitting on the toilet. Let's do this. And then the sphincters are relaxing, and the urine is, the bladder detrusor muscle is contracting, and the sphincter relaxes and lets the urine flow through. All right. So what should we expect with our bladder? What are we shooting for? What do we want to see? Love to see kind of emptying your bladder 6 to 8 times in a 24-hour period, or about every 2 to 4 hours during the day. Having a steady stream of urine without pushing, straining, or discomfort. No leaking or accidents, and then pale or clear urine. So that would, what we're hoping for, that's the goal. I know that doesn't always happen, so we'll kind of talk about, well, what are some of the things that can go wrong and what's causing that, or could be causing that. So some potential problems, big list of them here. They fall mainly into 2 categories. So difficulty with either emptying your bladder or with storage. So some of the things that can fall under those 2 categories would be frequency. So that is going frequently. So if you're going more frequently than every 2 to 4 hours, or every 2 hours, if you're going every hour, every half an hour, then you might be experiencing that frequency. Urgency, that's the feeling like when you're like, oh gosh, I gotta go right now and I can't hold it. That would be urgency. Leaking or accidents, repeat urges. So if you just went to the bathroom and then you left the bathroom and then you got a couple steps out and you're like, oh gosh, I gotta go again, that could be a repeat urge. Slow or asymmetrical stream. So asymmetrical is that it's kind of going off in one direction more than another. Hesitancy, so that's kind of difficulty starting your stream. Urinary retention, so that is when your bladder is having difficulty emptying completely, which can lead, if that urine stays in the bladder, it can lead to kidney infections and UTIs. So that's kind of a concern with urinary retentions, so frequent UTIs. And then nocturia, which is kind of waking up to go to the bathroom during the night, which can definitely impact sleep and add to the fatigue, so we want to address it. Okay, so what are some of the things that can be impacting the bladder function and causing these problems that we just talked about? Well, similar to when we talked about bowels, lesions can have an impact on your bladder. Just it can kind of mess with that communication and cause difficulties with your bladder function. Pelvic floor dysfunction, so similar to the bowels, your pelvic floor helps with holding your urine and letting it go. And so if you're having difficulties with those muscles, then that can lead to some of the problems we spoke about. Water intake. So I will say that I often hear people tell me that they restrict their water so that they don't have to go to the bathroom as much. But we will dive a little deeper into this later, but that actually can make your bladder symptoms worse. So we want to make sure that we are having enough water for our bladder. Bladder irritants. So concentrated urine is a very common bladder irritant. So if you're not drinking enough water, that can irritate your bladder. But then other bladder irritants, there are other bladder irritants as well that can cause your urinary symptoms to worsen. And then medications as well can impact bladder function. All right. So we're going to jump into some lifestyle modifications and strategies. So what are things, and we'll talk about the, we'll briefly touch on some other options as well, other than lifestyle modifications and strategies. But my hope for today is when we're talking through these for bowel and bladder function, it's things that what are some things that we might be able to start doing in the near future, today even, to kind of, that might help. So we're going to talk about water, bladder irritants, a toileting schedule, urge suppression, and double voiding. Alrighty, so can't have a bowel chart and not have a urine chart. So here we are. So this is a chart to kind of show you some different colors that you might be seeing when you're voiding your bladder. Our goal is to stick more towards the beginning of the chart. So that clear and that light yellow, that's kind of where we're looking for more. Now, I will say though that there are some medications and supplements and such that can impact the color of your urine, so they could cause them to change color, but generally speaking, looking more towards staying by that clear, that light yellow will help us know if we're hydrated and getting enough water. All right, so water, kind of how we talked about before. Goal is to drink about half your body weight in ounces of water per day. This can vary from person to person depending on the activity you're doing and how much you're sweating, just various factors throughout the day. But what we're looking for is that clear to pale yellow urine. Could vary with medication. I will say, similar to with fiber, you want to start slow with water. You don't have to take on that whole goal at once. You can each week slowly ramp it up by getting another cup in, and then bumping it up each week. Kind of how we talked about before is having that consistent water bottle. So I will say though that often when you are increasing your water, you're going to notice an increase in urinary symptoms. But usually what happens is within 3 to 4 weeks, those urinary symptoms should kind of level out, or when I say urinary symptoms, like the frequency and the urgency, it should kind of ease out a little bit, but you gotta give your body some time to get used to that. But it is super important to drink water. It can irritate your bladder when you don't drink enough water. That concentrated urine actually, well, there are pH receptors that in your bladder, and so when you have that concentrated urine, it can mess with those pH receptors, and that can cause more frequency and urgency and just an increase in symptoms. So oftentimes decreasing your water to avoid having the symptoms will actually make them worse. So water's good for many reasons, but helps the bladder out, helps with bladder spasms, or can help with bladder spasms, urgency, frequency, leaking, infections, and reducing kidney stones are all wonderful benefits of water. Something to keep in mind though is our goal is to get that water in earlier in the day. So usually when I'm talking with my patients or my clients, I often say a couple hours before bedtime is a good time to usually start slowing down on the water, just so that we're not getting up multiple times throughout the night to go to the bathroom. So seeing if you can get that water in throughout the day and then slowing down as you're getting closer to bedtime can often be helpful for people. I've also found with water, some people benefit more from sipping more versus chugging water. So kind of taking sip by sip can help more than chugging, and some people enjoy to chug it all at once. But I find that for a lot of people, sipping it helps them not to have as much urgency. That's different from person to person. Okay, so concentrated urine, big bladder irritant. Other bladder irritants are caffeine, alcohol, sugary drinks, aspartame, tea, constipation, and like I said, dark urine. Okay, so toileting schedule. So this can be really helpful if you're not sensing an urge, or if you're not sensing that the urine's passing. So this is the idea that you would set yourself a schedule. So you would be sitting down to avoid your bladder every 2 hours during the day and every 4 hours at night to avoid those accidents that are occurring if you're not feeling that urge to go. And then you can vary this depending on if it's working for you or not. So if you're still having accidents with the 2 hours, sometimes you can bump that up, or vice versa, depending on what you need to try to prevent those accidents. That is another strategy you can do. Now, let's say that you are not having those you're sensing that urgency, and you know it's happening, but you're just you're having strong urgency, and then you're having leaking and accidents, especially on the way to the bathroom. Something you could try is urge suppression, but I will, the goal of urge suppression is to retrain your bladder and then decrease the leaking or accidents. But I will say though that you want to make sure you're not retaining urine first, because we don't want to we don't want to suppress the urge if you're not emptying out completely. So just making sure that you are emptying out completely first. And so you can definitely chat with your doctor about it. They can do ultrasounds to check your post-void residual to see if you're getting all the urine out. But urge suppression can help with kind of suppressing the urge. And so some things you can try are, well, so the goal is to retrain your bladder and decrease the leaking and accidents, because what often happens is when people feel the first urge to go to the bathroom, their bladder is only halfway full, but we act on that first urge. And so whenever we act on that first urge, then our body gets used to needing to go on the first urge, and then that can lead to that frequency or more of that urgency. So the idea with urge suppression is retraining your bladder. You suppress the urge to retrain it to get more towards that 2 to 4 hours and to not have the emergency situation whenever you feel the urge. So easier said than done. But some things you can try, or telling yourself you can do it. I got this. I can hold my bladder. Contracting your pelvic floor muscles, deep breathing, like we talked about before with the diaphragmatic breathing, and then applying pressure to the perineum or the front area. Almost if you think of like crossing your legs, or when kids tend to hold the front area. But you can try that, and sometimes that helps. But the goal is with this as well, start slow. So sometimes you might try to push it 5 minutes, then 10 minutes to try to drag out how long you can hold it for. But I will say make sure you're not retaining urine first as a good rule of thumb. All right, got a little bit left here. Okay, next lifestyle modification is double voiding. So this is the idea that sometimes you will, if you have some urine that's still in there, but is not quite enough to be problematic. So if you're retaining some urine, but it's not quite enough to be problematic, and a doctor or urologist can definitely let you know how much you're retaining. You can try double voiding, which can get a little bit more out. And so what you would do for double voiding is you void your bladder, so you pee, and you change position by either leaning forward, side to side, just kind of moving around. You can stand up, and then you're going to sit back down or get back to your position and then try to void your bladder again, but make sure you're not strained to void your bladder. But sometimes just moving around can get a little bit more out. But once again, it doesn't do enough if you're retaining a lot of urine. But it can help, especially with some of those repeat urges, or I've had it help sometimes when people are dribbling afterwards as well, just to kind of get a little bit more out. Okay, so in review, we talked about the importance of water, bladder irritants, toileting schedule, urge suppression if you're not retaining urine, and double voiding. And we'll say for urge suppression, if you are retaining urine, sometimes you can use it just to get you to the bathroom in time, but I would definitely have a conversation with your doctor about that just to make sure we're keeping you nice and safe and healthy. Okay, additional options, pelvic floor therapy, discussed earlier, intermittent catheterization, indwelling catheterization, suprapubic catheterization, condom catheterization, pads, briefs, diapers, medication, and sacral neuromodulation are some additional options that we won't go into detail with today, but there are other options out there. But the lifestyle modifications are things that are easy to try, or easier to try. But all right, when should you call the doctor? So if you are feeling sick with flu-like symptoms, fever over 101 degrees, sudden pelvic pain or pain with urination, change in mental status, unable to empty your bladder, unresolved red and thick urine, or foul-smelling urine with symptoms of infection, those are reasons to give your doctor a call and see what's going on. So real quickly, before we take questions, is just want to touch a little bit on toileting strategies. So we talked a lot about bowel and bladder dysfunction and things to help with those, but then there's also the part of getting your pants up and down when you're going to the bathroom. That can be challenging. And then also sometimes hygiene afterwards or wiping afterwards. So a bidet, I have found with a lot of people that I work with, can be very helpful. It's either a button or a hose that you can get, one that you kind of spray in the front or the back area. The button often, I think, can be easier, but a bidet can help if you're having difficulty with reaching to wipe. Using elastic waist pants or shorts can help with getting those clothes on quicker or off quicker. If you're having difficulties with buttons or zippers, often a button hook can be helpful. This part is used for a button and this part is used for a zipper, so sometimes that can be helpful. If you're having difficulty with managing your clothes with standing, sometimes leaning side to side on the toilet to inch them up or down can be helpful. And then I also find if you're having difficulty with getting your pants back up afterwards, is if you insert your hand in the front of your pants and you rotate it around to the back with your palm facing outwards to grasp it to pull it up, I find that that also helps people to be able to get their pants on a little easier. So not quite bowel or bladder dysfunction, but I find that a lot of people tend to have or can have difficulties with toileting as well when they're in the bathroom. All righty, well, that is what I've got for you guys. At this point, I'm open to take any questions. I know we went a little over, but I'm open for any questions that you have. I'll do my best.
Absolutely. Thank you so much, Christine. Now, ladies and gentlemen, as Christine pointed out, we're ready for questions. If you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you will be able to unmute to ask your question. All right, let's get this underway. We're going to start off with an anonymous attendee asking, Christine, my main problem is going to the bathroom during the night. I rarely leak urine during the day, but at night I leak urine while walking to the bathroom. It happens almost every night, so I wear a pad to bed. Can you tell me why it happens mainly at night and not during the day?
So it's tough to, without having kind of a deeper conversation with what you're going on, but I'll tell you kind of what I find with many of the people I talk to, some factors that can be affecting nighttime. It depends on what you could be eating or drinking before you go to bed. So sometimes people have that tea before they go to bed, and that can then irritate the bladder throughout the night. Sometimes that happens for people. I've also found that sometimes if people are having a lot of swelling in their legs when they go to lay down, that can cause more problems as that swelling is going down, that fluid's moving, that they can tend to have to go more frequently or have more difficulties with that at night. Those are two ones that I often see with people for why it could be causing. I don't know if those are things that you're experiencing. Did I answer that question? Can you repeat what it was, why that might be happening? Was that correct, Aaron?
Yes, that is correct.
Gotcha. Yeah. So I often find that can be it. But I would say kind of starting with that bladder log can often, I mentioned this, but starting people with a bladder log to kind of track symptoms and when it's occurring and what we're eating and what we're drinking, and what activity. I just find that a lot of that can help point to the direction of what's causing it. But definitely a conversation you can have with your doctor to see if there's things that can help.
Okay, wonderful. Thank you so much. So Jennifer from Facebook asks, any suggestions if raw veggies cause loose stools or diarrhea?
So you could try various, or tell people you can often try various forms of vegetables to trying to cook them more. So I know that causes more work, but so there's a microwave or things like that, and you can see if you do better with different types of vegetables. I guess just cooked instead of raw, because that can be a trigger.
Okay. Okay, we have another anonymous attendee asking, can you please discuss neurogenic bowel issues?
Neurogenic bowel issues. So with a neurogenic bowel, you can have difficulties with storage and emptying, similar kind of we talked about the bladder. So with the neurogenic bowel, it's often that signal that gets, there's the communication because of the lesions and what was happening with the myelin sheath, that communication is not quite happening at how it should be. And so that can, when the signal is off, that can impact the emptying and the storage of your bowels. And so kind of what we briefly talked about with your sphincters have to play a role in it, and also your pelvic floor muscles. But if those signals are off, that can impact its ability to empty your bowels or store your bowels.
Okay.
Your stool. Empty your stool or store your stool.
So our next question comes from Deborah, who asks, I don't drink fluids past 7 p.m. So why do I have to urinate so much?
I'm guessing that's at night. Oh, that's tough. I guess it could be. I don't know if you're having any fluid in your legs or any swelling in your legs. It could be that it's kind of moving its way down when you elevate your legs at night. That I often see with people, and then I'll have them try to elevate before they go to bed to see if they can move some of it down. It's interesting though. I find that when people start making sure they're drinking enough water during the day, and you might already be doing this, that sometimes it can impact and help at night as well. Yeah, that's a tough one. I'd have to look kind of what your activities are during the day, but it could be that the swelling. Lost my train of thought. Could be the swelling, or kind of what's going on during the day as well.
Okay. So our next question comes from an individual asking, do those new Stay Dry chairs that you sit on that strengthen your pelvic muscles work for people with MS?
I am not sure about that. What I can do though is I work with some pelvic floor therapists here at the Shepherd Center, and I can definitely reach out and see if they've had some experience with them and how they feel about them. If you're able, I think, Erin, correct me if I'm wrong, if you're able to send that question to the email that you got when you registered, then I can get that question and I can pass it along and get back to you.
Yeah, I can absolutely do that. Renee asks, when I need to void stool, I get a discomfort in my hands, mostly the right. I've been told it's got to do with the nerves being affected. Is this true? This usually resolves after voiding.
So when you void your bowels, you have it was a pain in the right hand, you said?
Yeah, discomfort in the right hand mostly.
I am not quite sure. I've noticed that sometimes other symptoms do happen when someone's having a bowel movement, like fatigue or like symptoms can get worse with MS. I don't know if you're straining with it. So I'm curious if there's some straining going on with having the bowel movement that might be triggering or causing fatigue. I'm not quite sure about that one. But I have noticed that some people even experience heat intolerance, and which can make sensory symptoms worse too when they're having a bowel movement. So I don't know if something like that's going on that's impacting your hand.
So our next question comes from Marge, and she know what is insoluble fiber?
I'm sorry, you cut out there for a minute, Aaron. Do you mind repeating that?
Absolutely. I'm sorry on my end. What is soluble fiber?
So soluble fiber, like what types of food? I'm not sure about. If I don't answer your question correctly, or if this is what you're getting at, then feel free to email that. But soluble fiber is going to be, let's see, I have a whole list of them here. If I don't get them wrong. A lot of vegetables, and they're actually the skin is one type of fiber, and then the inside of vegetables is another. So kind of eating that with it. Hold on, sorry guys. So your soluble fibers are going to be your grains, so your oats, barley, legumes, so beans, lentils, peas, and fruits like berries, apples, bananas, citrus fruits, vegetables like broccoli, peas, and carrots. That's just a simple or small list of them. I often online there's a lot larger lists and such, but those are some. I often tell people that if you're looking down at your plate and it's colorful, then you tend to get a good amount of fiber in. But those are kind of your soluble fibers.
Now, Christine, forgive me, I might have cut off before I got to say the full word. I actually said insoluble. Now, does that make any more sense? That's probably in my own mind.
When it was cutting in and out, it was like so your insoluble fiber helps to bulk the stool, to move it. Is your insoluble fiber. So super important to kind of help with that transit time, to help that stool move through. So we want our stool to be moving through so that we're not experiencing constipation if it's slowly going through. But some examples of insoluble fiber is going to be your whole grains, so wheat, bran, nuts, and beans. But the insoluble fiber often works. They're both really important, the fibers, but it helps to bulk the stool to move it.
Okay, well, thank you for covering both of those. I'm sure everybody appreciates it. Now, before we get on to our next question, we are running up on 6 o'clock. So I was like hoping to find out if you'd be able to stay on maybe for 10 more minutes to answer a few more questions.
Sure.
Okay, wonderful. So Barb wants to know any ideas for fiber.
Any ideas for fiber? So food-wise, I would say kind of getting your vegetables and your fruit, nuts, grains, legumes, so that's beans. Those can be some ideas for fiber. There's also other forms of fiber that are more like over the counter, that's not your food, that you could chat with your doctor about to see if those would be appropriate for you. But food-wise, looking at your whole grains, your nuts, your beans, fruits, vegetables, especially if you're getting like sweet potatoes or fruits that have a skin, you're going to get both of those types of fiber.
Okay, wonderful. Margie wants to know, does yogurt and ice cream count as water/liquid?
Yogurt and ice cream. My vote would be no. I think, yeah. I would try to get that water in. I wish it did count. I want ice cream to count as all the things.
My gosh, me too. I was just like, nice try though. Next question is, can an internal and external TENS help with pelvic floor issues?
So they do have different types of therapies that can address like biofeedback, that can address your pelvic floor muscles. You need a pelvic floor specialist to kind of work on that with you, because there are people that spend a lot of time studying those muscles. So there are different modalities that you can use to address your pelvic floor, but you would need someone that specializes in, or at least that's my thought, someone that specializes in the pelvic floor muscles, because part of a pelvic floor, working on the pelvic floor muscles is often an internal exam, and so kind of checking to see how those muscles are working internally. So needs someone to know what they're looking for. But yeah, modalities can often be used.
All right, fair enough. This is from Brock. He says, as a man who uses a disposable catheter 3 to 4 times a day, is there any data relative to the long-term impact of doing that? Any worry about long-term issues of any sort from that? I've only been using it for 9 months so far.
Well, I'd have to look further into that one. I have kind of read some articles and such about, risk of infection and things. And once again, that's kind of weighing your pros and your cons, and why it's important when you're doing intermittent catheterization, I think is what you mentioned you're doing, to make sure you're staying clean while you're doing that, so you're not increasing your risk of infection. I do not know about kind of the long-term. I think more of the articles I've read have been more about just making sure you're avoiding infection. But it can also often give people a great quality of life, and that kind of outweighs the cons that may happen.
All right. So Brock would like to know, having been prescribed, I might be butchering this, so I apologize. Myrbetriq. Yeah. How does it work? What does it do and how?
So I am going to be the first to say that I am not an expert at medication, and I will not pretend to be one. That is definitely a conversation I'd have with your doctor or your PA, because they definitely specialize in medication. They do not give me the power. And I don't know if I want that power to give medication, but yeah, sorry, I don't quite know that one.
Okay. This individual would like to know, is sparkling water like Waterloo or Spindrift okay to count towards water intake?
Yeah, sometimes it can be an irritant. So that's one of those things that I would say, trying, if you're experiencing an increase in symptoms like frequency or urgency, I will often tell people, okay, let's go ahead and do a bladder log to track what you're drinking when you're drinking it and when you're having those issues. So if you're drinking a sparkling water and then right after or soon after you're having an increase in symptoms, but then when you drink regular water, you're not, that would be something to note. So it's definitely fluid in water, but I do find that sometimes the carbonation could be irritating, but it's honestly different from person to person. There's a lot of things that can irritate your bladder, but it's not irritating for everyone. Some people can drink tea and do just fine, where others will drink tea and they'll be peeing every 30 minutes. So.
Okay. Sharon would like to know, because of no sensation in that area, I have had bowel movements and it's even landed on the floor by the toilet and not even knowing it. Thinking about urinating and have a bowel movement makes me have an urgent need to go to the bathroom. It seems my bathroom events are on a schedule, but it's in the middle of the night and it's at least 3 times. If I wait, I'll pee in the bed. How do you get to change your schedule? Same thing happens when I do water aerobics. Again, I can't wait or I'll make a mess.
So it's tough for me. So just a disclosure here is I can't give everyone, I can't give specific advice for everyone because I don't know your whole story. So kind of the things I'm mentioning to you guys are just general things I've heard, or when I work with people that tend to work for them. But definitely I would say if you're having difficulties, reach out to have, a therapist or a doctor work specifically with you who knows more of your full case and what's going on. So just can't give you specifics necessarily, but it might be a conversation of looking into kind of what type of bowel program you're on. So I don't know if you said in there, Aaron, if it was a self bowel program or it was like an enema or different things to mention. But I guess looking at kind of what your bowel program is, and if working for you, and if that type of bowel program needs to change to get it more on a routine. So it sounds like it's happening at times that you're not wanting it to happen. Did I answer that question, Aaron? I got parts of it.
Yeah, it was more about being on a sort of, there was a few portions of it, but it was mostly about how do I kind of change my schedule.
Gotcha. Okay. So sometimes people find that if they create that routine, they sit at those times each day, they can sometimes retrain it. It also could be that conversation, like I was saying, with your doctor to see if there needs to be another bowel program to help you empty at a certain time each day.
Okay.
But sometimes just having that routine time, like changing your time, can be helpful. But it sounds like, yeah, reaching out to some specialists to see specifically what would work for you.
Okay. Another individual would like to know, is it common with MS for some of these symptoms to come and go? Is it worrisome for them to come and go?
So not specific what symptoms you're specifically talking about. I will say though that I have noticed with some of the people I work with that fatigue can play an issue with bowel and bladder dysfunction. So if the clients I work with, if there's an increase in fatigue or there's heat intolerance, that sometimes that bowel and bladder dysfunction can get worse. So that is something to think about, to kind of take a peek at and see, okay, what's going on when it is getting worse. Also, infections can cause more problems too. But yes, so there's a couple of factors that can cause it to come in and go, or flare up more, I guess you could say.
Okay. Karen would like to know, did you say carbonated water aggravates a bladder?
It could be a trigger, and so that's one of those things that I would track it to see if it's impacting your bladder.
Okay. Renee is asking, I'm struggling with random bowel incontinence. Have been unable to connect to specific foods. Stools are always a 4 to 5 when that happens. No warning. So frustrating. Happens maybe once a week. Doctor suggests looking into implant, but I'm leery. I think this is more of a statement more than anything, but is there anything that you could possibly add to that?
So you're type 3, 4, you said. I don't know if you've gone to a GI specialist or not to see if there's anything that's specifically irritating. So sometimes I'll send people that direction. Also looking at maybe working with a pelvic floor therapist to see, often direct people to our pelvic floor therapist to see how the muscles are functioning. If they're unable, I don't know if it mentioned if there was an urge when that happened, if you had that, if you sensed the urge or could tell you needed to go, but sometimes a pelvic floor therapist can take a look at those muscles to see how they're helping to hold that stool in and the coordination of it.
Okay. And we'll have time for 2 more questions. This is from Monia, who asks, what about a Botox shot in bladder? Also, is Metamucil, Psyllium, Husk pills good for constipation?
Botox is definitely an option. That would be a conversation I usually have my clients have with a urologist to see, or whoever is working with you on your bladder, to see if it's helpful. They have so many different urodynamics and different assessments that can really see what's going on with your bladder specifically and what would be the best option if you are having that spasticity, or that Botox would help. So it's definitely something that I've had people complete, and so it just depends on kind of what your urologist or your doctor thinks would be the most helpful. And then the second question was about psyllium, right? So that is fiber that can often be used for constipation.
Okay. And we'll end on this one from an anonymous attendee. How much fiber should we aim for each day?
Ooh, so it varies for men and women. And I would say if you're looking for specific things for you, kind of, I can't give specifics for for a person. Dietitian is great to kind of help with that, but in general, you're looking around, it's like I think 25 grams for females, and I do believe I wrote down the exact numbers here so I would get it. It's like 20 to 35. I think it varies between male and female. Hold up. Let's see. I did write down these specific numbers just in case someone wanted to know. So this kind of one source that I love talks about how adults up to age 50 is 25 grams for women and 38 grams for men, and then older than 50, 21 grams for women and then 30 grams for males. So they often say like 20 to 35 grams, but they do sometimes break it down by gender and age too for those more specifics, but yeah, it can vary.
Okay. And I just want to let everyone know, we unfortunately are not going to be able to get to everyone's questions. For any unanswered questions, we do recommend that you join us next month on Tuesday, October 11th at 4:30 p.m. Eastern. We'll be having our next town hall with Senior Medical Advisor Dr. Ben Thrower, and who will be happy to answer all of your questions. That's specifically all he's doing for the hour. So with that being said, that brings us to the end of our time. If you miss any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Reply to your registration email for information on how to access recordings, or sign up for our newsletter to learn about upcoming events. Speaking of which, our next teleconference will be Managing Emotional Changes with Dr. Fred Foley on Monday, October 3rd at 4 p.m. Eastern. As you leave the conference today, a survey will appear on your screen. We ask you to please take a moment to give us your feedback on this program and your suggestions for future topics, so we can be able to provide you the best programs possible. I want to give a sincere thank you to all of our attendees for your participation, and especially to Christine Hampton. Thank you so much for the time you spent to prepare and share this information with us. Have a wonderful evening, everyone. Thank you so much for joining.